Hey future doctors, welcome to Dentistionary here. You will be provided with information for the doctors from the doctors. Today, we'll be studying about deglutition on the request of our viewer, which he commented before, and we are very late, so we are very sorry about this video because we are very late. So let's start without wasting any time. What's deglutition? Also called swallowing, which we do it normally, but we don't know how it occurs. It has a very good and interesting process to begin with. Its mechanism is quite complex if you go deeper details, but if you study it superficially or at the first year level, you will understand it very quickly. It is a process by which food moves from the mouth into the stomach with some few movements in our body. The structures involved in this are, first of all, our mouth. And mouth has so many things: a mandible, maxilla, heart, palate, toes, or teeth, tongue, mylohyoid muscles, glenoid muscles, hyoid bone, glossoepiglottic fold, soft palate, nasopharynx, posterior pharyngeal wall, uvula, palatine tonsils, palatopharyngeal arch, palatoglossal arch, epiglottis, epiglottic cartilage, esophagus, and many more things are involved. In the stages, we have three stages: oral, pharyngeal, and esopharyngeal. An oral stage, the food moves from the mouth to the pharynx. Then in pharyngeal, it continues from pharynx to the esophagus. And then in the esophagus stage, it continues to move forward from esophagus to the stomach. And from stomach to the excretion, it's called digestion. But the movements are same in the digestive system. So in stages of deglutition, the preparatory stage in which we just make a bolus by mastication. So here the soft palate, between the soft palate and the tongue, the bolus is there, hard palates which we use for the mastication, epiglottis and all these things. Epiglottis it helps in the proper way of swallowing food to the esophagus, so it does not goes into the trachea or the windpipe. So these are like this: the oral phase. This is the oral phase from oral cavity to the pharynx. Then this is pharyngeal stage from the pharynx to the esophagus, and then the esophageal stage from the esophagus down to the stomach. So in the oral stage of first stage, it is a voluntary state, so we do it ourselves. Okay, we do it ourselves. In this stage, the bolus from the mouth passes into the pharynx using a series of actions. Which actions? The bolus is placed over the posterodorsal surface of the tongue. The posterodorsal surface, the tongue is like this. So here, okay, it is called the preparatory position, as we seen in the previous image. Anterior part of the tongue is retracted and depressed against the hard palate. So the tongue is like this, pressed against the hard palate and retracted. Okay. Posterior part of the tongue is elevated and retracted against the hard palate. This pushes bolus backward into the pharynx. So it pushes the bolus here into the pharynx. Forceful contraction of tongue against the palate produces a positive pressure in the posterior part of the oral cavity. This also pushes the food into the pharynx. That's how it works. Pharyngeal stage or the second stage, it is involuntary. Your wish is not involved in this. It against your wish. But it is involuntary because you are not conscious about this, and it happens unconsciously. Because that's a natural process. Just like blinking your eyes, you can just hold it for some time, but it will eventually start again. Or the heart beating, peristaltic movements in your body. These are involuntary actions. In this stage, the bolus is pushed from pharynx into the esophagus. Pharynx is a common passage for food and air both. Okay, so it divides into the larynx and esophagus. Larynx lies anteriorly and continues as respiratory process. So it joins with the trachea. Okay. The esophagus lies behind the larynx. So it continues as the GIT tract. So it continues the GI tract with esophagus. Okay. Since the pharynx communicates with the mouth, nose, larynx, and esophagus during this stage of deglutition, bolus from where bolus from the mouth to the pharynx is changed. How? It can enter into four parts: back into the mouth, upward into the nasopharynx, forward into the larynx, downward to the esophagus. However, due to various coordinated movements, the bolus is made to enter only the esophagus. So this one is the right path. Back into the mouth. It can happen if you had hiccups or GERD. You will study after. Upward into the larynx, or we can say nasopharynx into your nostrils. So if you had, which we call TASA, or if the food is stuck or touched on the uvula or the soft palate, the emetic type of movements are there, like vomiting. So it goes into your nasopharynx and comes out, it will come out from your nostrils. Like when we drink water and someone just make a joke and we laugh during the swallowing of water, we will get cough and the water will come out from your nose. Forward into the larynx, it will choke your trachea. We will have to give then Hamlet's maneuver to remove it, or the cough will come and the hard pressure of air will come from the lungs to remove it. Okay. However, coordinated movements prevent it. Pharyngeal stage may entrance of bolus through the other pass is prevented as follows. Back into the mouth. Return of bolus back into the mouth is prevented by position of the tongue against the soft palate or the roof of the mouth. High intraoral pressure developed by the movement of the tongue. How it is prevented? Movement of bolus into the nasopharynx is prevented by elevation of the soft palate along with its extension called uvula. Okay. Forward into the larynx. Movement of bolus into the larynx is prevented by approximation of the vocal cords. Forward and upward movement of the larynx. Backward movement of epiglottis to seal the opening of the larynx or the glottis. All the movements arrest respiration for a few seconds. So if you swallow something, the respiration or the exhalation and inhalation will stop for a moment. This is called the deglutition apnea. Okay, what's deglutition apnea? It refers to a temporary arrest of breathing. So during swallowing apnea, it is the arrest of the breathing during the pharyngeal stage of deglutition. Now enter of bolus into esophagus. As other three paths are closed, the bolus has to pass only through the esophagus. This occurs due to the combined effect of the various factors. Upward movement of the larynx stretches the opening of the esophagus. So it widens and opens. So bolus just moves smoothly into the esophagus. Simultaneously, the upper 3 to 4 centimeter of the esophagus relaxes. This part of the esophagus is formed by the cricopharyngeal muscle, and it is called the upper esophageal sphincter and pharyngoesophageal sphincter. Okay, so this name is also same. The cricopharyngeal muscle makes up the sphincter, which is called upper esophageal sphincter or pharyngoesophageal sphincter. At the same time, peristaltic contractions. This is very important to notice. The peristaltic contractions start in the pharynx due to contraction of pharyngeal muscles. Elevation of the larynx also lift the glottis away from the food passage. All the factors mentioned above act together so that bolus move easily into the esophagus. This whole process takes place within 1 to 2 seconds, and this process is purely involuntary. Esophageal stage. It is also an involuntary stage. Food from esophagus enters the stomach. So it forms the passage for movement of the bolus from pharynx to. So it is a food pipe. It is a pipe which connects the mouth to the stomach, and it is a pathway for the food to go smoothly towards the stomach only. Only stomach and nowhere else. Movement of the esophagus are specifically organized for this function, and the movements are called peristaltic waves. So it happens like this is your esophagus, and the peristaltic movements like this. If you will see a video on YouTube or anywhere else, you will find very interesting how these movements work. Peristalsis movement means a wave of contraction followed by wave of relaxation of muscles, fibers of GI tract, which travel in an aboral direction. So, first of all, in normal position, it's straight. Peristaltic movement occurs, so contraction. Okay. Then, if you elongate this like this and here, so this is the relaxation which occurred here, and now further contraction occurs. So it pushes down the food. By this type of movement, the contents are propelled along the GI tract. Esophageal stage or third stage, when the bolus reaches the esophagus, the peristaltic wave are initiated. Usually two types of peristaltic contraction are there, the primary and the secondary. What are these? When the bolus reaches the upper part of the esophagus, the peristalsis starts. This is known as primary peristalsis. After origin, the peristaltic contractions pass down through the rest of the esophagus, propelling the bolus towards the stomach. Pressure developed during the primary peristaltic contraction is important to propel the bolus. So pressure is very important in the oral cavity, in the pharynx, in the esophagus, and anywhere else to the body. Initially, the pressure becomes negative in the upper part of the esophagus. This is due to the stretching of the closed esophagus by the elevation of the larynx. Okay, but immediately the pressure becomes positive and increases up to the 10 to 15 centimeter of the H2O. Secondary peristalsis movement or contractions. If the primary peristaltic contractions are unable to propel, then the secondary peristaltic contractions appears and push the bolus into the stomach. These are induced by distension of the upper esophagus by the bolus. After origin, these contractions pass down like the primary ones, producing positive pressure. So if negative pressure occurs, however, there is primary contraction and positive pressure. If the negative one occurs, then the secondary peristaltic movement starts and it pushes down the bolus forcefully. So what is the difference? The primary one is initiated by swallowing and begins when food passes into the esophagus from the pharyngeal cavity. But it is initiated by the presence of food within the esophagus after peristalsis is completed and is due to stimulation of mechanical or irritant receptors. So when you get hiccups or thassa and all, you will have secondary esophagus peristalsis. So sometimes your food pipe will begin to hurt, or for few minutes you will have ache in above the sternum. It is coordinated by vagal fibers which originate from the swallowing center within the medulla, but secondary one is coordinated by intrinsic nervous system of the esophagus. Now the role of lower esophageal sphincter. Upper we have studied the lower one. Now the distal 2 to 5 centimeter of the esophagus act like sphincter, and it is called lower esophageal sphincter. It's constricted always. When the bolus enters this part of the esophagus, this sphincter relaxes so that the contents enter the stomach, and then it again contracts or constrict its path. After the entry of bolus into the stomach, the sphincter constricts and closes the lower end of the esophagus. Okay, the relaxation and constriction of the esophagus sphincter occurs in the sequence with arrival of peristaltic contractions of the esophagus. So it follows the primary and secondary peristaltic contractions. Now the deglutition reflex, what is that? Through the beginning of swallowing is a voluntary act, later it becomes involuntary and is carried out by a reflex action called deglutition reflex. Okay? It occurs during the pharyngeal and esophageal stages. The stimulus, what's the stimulus? When the bolus enters the oropharyngeal region, the receptor present in this region are stimulated. The afferent fibers or the afferent impulses from the oropharyngeal receptors passes via the glossopharyngeal nerve fibers to the deglutition center. The center then is at the floor of the fourth ventricle in the medulla oblongata of the brain. You will study it in your human anatomy class. The fourth ventricle of the medulla. It's not the ventricle present in your heart. It's different ventricle. Afferent fibers, then these impulses from the deglutition centers travel through glossopharyngeal and vagus nerves. The parasympathetic motor fibers reach the soft palate, pharynx, and esophagus. The glossopharyngeal nerve is concerned with the pharyngeal stage of swallowing. The vagus nerve is concerned with the esophageal stage. Okay, so it moderates the pharyngeal and it moderates the esophageal stage. Then what's the response? The reflex causes upward movement of the soft palate to close the nasopharynx and upward movement of the larynx to close the respiratory passage so that bolus enters the esophagus. Now the peristalsis occurs in the esophagus, pushing the bolus into the stomach, and digestion happens. That's all about the deglutition. Thank you so much for listening to me. I hope you found this video useful. If you want the PPT, follow the link below. If you have any doubts or queries about the topics or anything else, please comment down below. We will try to solve it as soon as possible. Thank you so much.